Hello, my name is Kelly Reagan, and I am a student physical therapist at the University of Arkansas for Medical Sciences. And today I'm going to be doing my presentation on eating disorders in 2022. So, this is a video that talks about the prevalence of eating disorders in 2022 and the fact that we have a lot more prevalence of these eating disorders in younger populations due to their exposure to social media and just the content that they're going to be exposed to at such a young age. And I also believe that we are going to continue to see a rise in eating disorders in our country if there are not more strict guidelines put on the content that is being posted. So check this video out. It's a really good summary of what these kids are being exposed to at such young ages and the impact that they can have on these kids' lives. So definitely check that out. So definitely check out that last video. And some general information that I want to go over first is some definitions of the most common eating disorders that we may see as physical therapists. So the first being anorexia nervosa, and it is a potentially life-threatening disorder characterized by abnormally low body weight, intense fear of gaining weight, and disordered perception of weight or shape. So those with anorexia are using extreme efforts to control their weight. Usually this is going to be through extreme diets and really limiting their calorie intake to dangerously low amounts, and to the point it can be of self-starvation. And that is also why this is one of the more life-threatening of the eating disorders, because their calorie intake is so low that they're hardly able to support their organ function and support their body through the calorie intake. With bulimia nervosa, this is characterized by episodes of binging and purging and the feeling of lack of control over eating. So with bulimia, these individuals are typically eating large amounts of food in a short time, and then they are trying to rid themselves of those extra calories in an unhealthy way. This can be through excessive exercising, vomiting, or purging, or other methods such as laxatives in order to rid themselves of those extra calories. With binge eating disorder, those are episodes of eating too much food, binging at one period of time, and feeling a lack of control when eating to the point of feeling uncomfortably full or eating when not even hungry. So with those with binge eating disorder, the difference between bulimia and binge eating is those with binge eating typically aren't going to try to rid themselves of those calories as they would maybe with bulimia nervosa. So after a binge, the person may feel guilty or disgusted or ashamed with their behavior, but there usually isn't going to be compensation. So with binge eating, those individuals may try and eat alone or hide whenever they are eating due to embarrassment of how much that they are eating. Okay, so now I want to talk about the prevalence of these eating disorders in the population. So with anorexia, that is about 1 to 1.5% of all women and 0.5% of men, and it's going to be more prevalent in individuals younger than 40, and there is a 5% mortality rate with individuals that have anorexia. So again, we're seeing that 5% with those individuals with anorexia because it's more of a life-threatening disorder, as we talked about earlier. And with bulimia, it's about 1 to 1.5% women and 0.5% men, and it's going to be more prevalent in African American teenagers, Asian college students, Hispanics, and homosexual men. So I think that sometimes when individuals think about eating disorders, we don't always include the prevalence of men that are included in eating disorder statistics. So definitely keep that in mind whenever you are out in the field and in the workplace, to not exclude men from this population. And with binge eating disorder, that is going to be 3.5% of all women and 2% of men. And with binge eating disorder, about 87% of those individuals are going to be obese and have difficulty with emotional regulation. So that kind of ties into you feel out of control with your emotions, you feel out of control with your eating habits. Those definitely have a really close, they go hand in hand. So what are some of the complications related to physical therapy that we might see in this population? So you may see decreased bone density and decreased muscle mass and strength. Those also go hand in hand because we need that muscle mass to pull on the bone in order to have bone growth. We need exercise. We need weight-bearing exercises. And if these individuals are intaking such low amount of calories, then they're going to have a really difficult time building muscle mass, building bone density. So those are definitely two of the red flags that we want to look out for, and deficits that we may be treating in these individuals in the clinic. Also decreased cardiovascular endurance, decreased cardiac function due to electrolyte imbalances. So that goes again with the low caloric intake. If these individuals aren't getting the calories that they need to sustain their cardiovascular system, our organs need calories to survive as well. So you may see that they have some arrhythmias or cardiac dysfunction as well. So definitely need to keep that in mind when treating these individuals. You may also see potential syncopal episodes. With that low blood volume, low blood pressure, you might have syncopal episodes. Definitely keep that in mind. And also low energy availability. So due to that low caloric intake, they may just have very low energy reserve, and just the simplest tasks might just seem overwhelming to these patients. So these are some of the things to look for. This definitely is not an all-inclusive list, and you want to make sure that you treat all of your patients uniquely. Every diagnosis is going to look a little bit different, and every patient's plan of care and how they need to be treated is going to be different from the last. So keep this in mind whenever you're creating that exercise plan for your patients, that their situation is unique. So let's say that you have a patient in an outpatient clinic and they're being treated for something that is not related to eating disorders. So what are some of the screening tips and tools that we can put in our toolbox that can help us identify these eating disorders in patients that's not their reason for being in the clinic? One of the things that you can always do in your patients is go ahead and do a weight assessment, take their BMI, just wanting to assess and make sure that they're at a healthy range for their age and for their gender. And you can ask about their diet and nutrition habits, just wanting to make sure that they're getting all the nutrients that they need. You can ask about fractures or broken bones. This can have a lot to do with that low bone density, and this can go for all of your patients. Doesn't necessarily mean that they have an eating disorder, but it's just something that is good to screen in all of your patients. And in female patients especially, you can ask about menarche and regularity, and you can also ask about mental health and screen for their mental health and well-being. This is something, as being in the medical profession and with direct access to physical therapy, we need to be able to screen for mental health conditions and feel like we are confident in this area and that we can directly address our patients about mental health. So I think that this is something that physical therapists need to be more experienced with, and we need to practice more asking about mental health in our screening. So let's say that you have identified some of these red flags in your screening process and you're suspecting that your patient might have an eating disorder. How do you go about having this conversation and communicating with your patients? Well, if your patient is a minor, you want to make sure and ask your patient if they want their parents or their caregiver involved in that conversation. Some adolescents may feel embarrassed or uncomfortable if their parent sits in on that conversation, and they may just want that to be between you and them. So definitely ask them how they want their parents to be involved in that conversation. And assure that patient that they're in a safe space. Everything that they want to discuss and talk about is totally safe, and they're in a comfortable environment to be able to discuss those things. It's already intimidating talking to a healthcare professional about your health, and especially something as sensitive as a mental health disorder or an eating disorder. So assure them that they're in a safe space. Validate that patient's thoughts and feelings. Make sure that they know that it is okay to feel the way that they are feeling, and that there are other people that are struggling with the same thing and the same habits, and they're not alone. and listen to the patient before jumping in and trying to give advice. It can be just our instinct as medical professionals to want to jump in and help as much as possible, but sometimes the best way that we can help some of these patients is just to have 2 listening ears and listen to them. And they may not have had someone that they could talk to about their eating disorder and their eating habits. So you might be the first person that is actually just sitting with them and able to listen to them about what they are going through. And ask the patient if they would be open to speaking to someone who is an expert in the category. So we are experts in our field of physical therapy, and we wouldn't want somebody else telling us how to do our job and wanting somebody else to give expert advice in physical therapy if they are not a physical therapist. So I feel that this is important to definitely offer a solution to that patient and offer a solution to that problem. Give them the resources to go to a professional if they want those resources and if they need referral. So definitely let them know that there are professionals, that this is what they do. This is what they went to school for, and they are there for them, and give them those resources. So when to refer these patients? How do we know when we should take that next step to giving that patient extra care, or even to reaching out to their primary care physician? So if the patient is so underweight that you feel like it is life-threatening, if the patient reports thoughts of self-harm or neglect, if the patient expresses interest in further resources and help, and if the patient shows signs of mental health illness, these are all reasons that you should reach out to that primary care provider and get that patient the help that they need. So thank you for listening to my presentation, and I hope that you guys learned something new today.